All right, so welcome everybody. We're down to our last session, the nonprofit panel, and we figured we would save the absolute best for last. You guys are in for a tremendous treat because the panel we have assembled here today is probably one of the best panels you'll ever hear from. I want to kind of pump you guys up tremendously so that you guys are on the top of your game here. So before we get started, I'm going to give everybody a chance to maybe introduce themselves for a minute or so. If anybody has questions as we're going through this for the panel, please just pop them into the chat. So Randy, why don't we start with you? If we can kind of keep this to maybe a minute or so, that'd be great.
So I'm really honored to be here, and I appreciate all the work that you do, Ken, and your firm for the nonprofit sector. My name is Randy Shubin-Dresner. I'm the president and CEO of Island Harvest Food Bank. I've been with the food bank for 22 years, and we are helping to feed and support over 300,000 people across Long Island. Our services include, of course, food distribution because we're a food bank, but we recognize we're never going to end hunger by just giving somebody a can of food. And so our programs of short-term case management, nutrition counseling and outreach, and many other services. We have a workforce development institute and many other services where we could really be sure that we're holistically helping our neighbors who are in need and help move them to from uncertainty to stability.
Awesome. Bobby?
Good afternoon. Thanks for having me. My name is Bobby Brown. I'm the executive director of Young New Yorkers. Young New Yorkers is an art-based nonprofit that provides alternative incarceration options to young people who are charged with a felony and or misdemeanor throughout all 5 boroughs. We've been in operation for 10 years. And really, I think what makes us effective as an organization is that we connect with our young people. We understand and we continue to connect, right? Once we hold that hand, we maintain that handshake. So that is something that's very magical for us. A little bit about myself. I've been working in this industry for, oh my gosh, 17 years. I hate to admit that already. As an educator, program developer, all amongst the span, but mainly around criminal justice reform. And I'm also an artist and an attorney by training. So I'm glad to be here today. Thank you.
17 years, so you're a newbie. David?
Hey, Kent, thanks a lot. Thanks for having us on today and for hosting this. Appreciate it. So my name is David Nimroff. I'm the president and CEO of Harmony Healthcare Long Island, formerly the Long Island FQHC. And we are mostly a healthcare provider. Our mission here is to really provide access to equitable, optimal healthcare by improving the overall wellness of individuals in our communities and delivering high quality, comprehensive patient-centered care. We're about 14 years young as an organization. We operate 6 freestanding locations in Nassau County and 3 school-based health centers. All in total, serve about 44,000 individuals in our various programs. We do have women's, infants, and children's supplemental nutrition programs co-located in 3 of our health centers. We also have health home care management for chronically ill children and adults, and provide an array of medical services from pediatrics to primary adult care, to women's services, to dental, behavioral health, nutrition, podiatry, optometry, and more. Our focus here is really on the social determinants of health and how to help improve people overall wellness so that they can be, optimum members of society and really focus on some healthcare disparities for our communities who may have been left behind in the past when it came to health equity.
Awesome. And then last but certainly not least, Lisa.
Thank you so much for having me. I'm quite honored to be among such amazing people. My name is Lisa V. Lewis, and I am the founder and the executive director of Omnium Circus. Why a circus? Omnium Circus is a singularly inclusive, accessible nonprofit circus that is multi-abled and representative. We highlight and celebrate that disability and diversity shine through the joy and the excitement of circus arts. We are built on a tripod of entertainment, employment, and education. Omnium Circus is comprehensively inclusive and accessible on stage, behind the scenes, and in our audiences. What makes us successful is that we are creating a space beyond the work, creating a safe space in society as a whole through popular entertainment, where people of all abilities, all races, all genders, all communities, and all cultures can come together and find what they have in common, what can unite them, not what life takes us apart for many, many different reasons. But this space is a space where everyone can unite and come together and share a positive experience and plant seeds of taking that back to your workplace and saying, hey, maybe I misjudged you. Hey, maybe there's more that we could do here. So planting the seeds of unifying our community and our communities as a whole through our work in everything we do. We're 40% people with disabilities, and we do shows live and virtual, and here we are. We are 3 years young.
Awesome. So now everybody's got a chance to meet all of you. So let's kind of dive into this. I mean, obviously, one of the biggest issues that's facing the nonprofit sector today is staffing, right? Everybody's having concerns and issues with staffing. Workplace has changed. People are asking for more flexible hours. There's a greater emphasis and focus on leadership. And in many cases, there's staffing shortages. So how is your organization addressing this? So David, why don't we start with you?
Thanks, Ken. Of course, I'm the first. It is rough. I will not sugarcoat it. It's been a challenge. So we're in the healthcare space. So we range from positions such as a medical doctor down to maybe a clerk or a medical assistant, or even a social worker or a care manager. And across the spectrum, we saw post-pandemic last couple of years a very high turnover rate. And unfortunately, we're also here in Nassau County, where you have some large health systems who are just plain simply offering some of our medical providers just more money. So that's been a challenge. We've tried to, with telehealth, offer some flexibility where we could, but some state rules have changed that have made that harder for us to do with reimbursement. We're looking at could we do a 4-day work week for a provider instead of a 5-day work week, which is hard because we still want to have patient care and access. So that's really, really difficult. And we're looking at part-times and flexible schedules. So what can we do to folks? Hey, can you give us as a provider, 4 hours in the morning or 4 hours in the evening because of childcare? And then we're just looking for various incentives to help our folks wherever we can, from additional trainings to some folks struggled, with even the challenges of behavioral health. So offering EAP to employees to help them through some of these challenges. But yeah, we're doing a little bit of everything in terms of greater pay for some folks where we have to, flexible schedules when we can and not affect patient care, incentives such as training and other things that are needed for our folks, and then looking to we've even offered a bonus to employees who recommend people. And so if they're recommending, and that person stays with us, we will give them a bonus for recommending. So our employees, who are our best resource, self-selecting others to join the organization. So anything and everything. And before it used to be word of mouth, now it's a lot of advertising and really trying to connect with medical schools and high schools for young kids who want to get into the field. We've grown the umbrella of what we look at to bring on people as well.
Yeah, I mean, I think that's been part of the biggest problem. Is there are certain pockets of the industry, healthcare, one of them, where you've got less people kind of going into the profession. There's more of a push to find people.
And we've also unfortunately had to sometimes get mid-level individuals. So if you couldn't find a medical doctor, you're getting a nurse practitioner, and if you couldn't find a nurse practitioner, sometimes you're finding a physician assistant because there's more availability. So we've also changed a little bit about how we're able to hire, because we have to be creative to provide that care.
All right, Lisa.
So as a younger organization, we don't have a lot of established full-time positions. So for us, remaining remote actually was very, very productive. So it has allowed our workforce to be able to work for us part-time and take on whatever other jobs, to work from home. 50% of our back office people are all people with disabilities. So allowing them to be in an environment where they're comfortable, where they're wheelchair, if they use a wheelchair, is in a space that they've already created that is comfort for themselves, allows them to be their most productive self and allows them to give us the best 15 hours they have that particular week. We're pretty flexible on scheduling as well. So that has worked out very well for us, and it's allowed us to retain people that we would not have otherwise been able to afford or to provide appropriate compensation for, because they're allowed to retain whatever other jobs they have. So that's been super helpful for us. We've also made great use of interns. We found some really, really wonderful interns and have tasked them with researching a lot of work that needs to be done can get up to a certain point at an intern level before a managerial level person has to take it over or an executive team member has to take it over. And we have a very active and engaged board who steps in at that level. So we've been able to really spread the work out a little bit with the use of really, really great interns from underserved populations. There are a lot of organizations that we love collaborating with that provide interns that wouldn't necessarily be in anyone else's radar immediately. Like it would be someone you had to dig for. So by digging, we found people who were really qualified and really excited to work on the project.
Great, Bobby.
Yeah, I'm over here shaking my head at what Lisa's saying, because interns is definitely an area that we've explored and continue to explore. And I just know from previous experiences that, you know, there's a lot of work, you're right, Lisa, that can be done prior to managerial step in, right? So that ties into what we're doing at Young New Yorkers, multi-purposing, really thinking about the varying skills that our staff has and how can we use those skills in various ways with their consent, obviously. But, you know, thinking about how we can multi-purpose them, right? It's a very small staff, I know for us, because we, you know, we're a small nonprofit, we're under a 10 staff arrangement, and I've been in my position for about shy of a year. So it's really trying to understand, you know, the capacity of the team, moving people around, and letting folks volunteers because we have a lot of vacancies because of the build out, right? And to Lisa's point as well, there's only one full-time member on the team, right? So there's a lot of hat wearing, multiple hats that people are ready to get to. And I think the other issue with capacity build is not so much of looking for flexibility in hours, as we have members who are looking for more hours. So with budget cuts amidst and a lot of changing in funding, wanting to be able to meet their minimum so we don't lose that energy, because getting compassionate people who are super excited about the mission, which we currently have, but not being able to make sure that they can make their ends meet is also detrimental at times. So that's the balance that we kind of work with right now.
And finally, Randy.
You know, it's a changing market. It's a very competitive market. We're certainly in the same place as many of us, many of our colleagues on the call, but also so many others across our communities. We came off of a very tough time. The pandemic changed our organization. We increased our staff by over 50%. Immediately, and we retained all of those positions and even grew some of them after the pandemic. And now what we're really looking at is what is the post-pandemic reorganization plan? What are we doing to change? What do we need to keep? And what has to be adapted a little bit? We have certainly lost a couple of key staff people. It was anticipated. We were never remote as a first responding organization during the pandemic. We literally ran to the fire. And so we were open every single day throughout that pandemic. So it was really heavy on our staff, emotionally and physically. And the growth of the organization at such a fast pace also had an impact. And so we did lose a number of people immediately following. I can't say that the pandemic is over necessarily, but immediately following that. And now we're looking at how that is impacting our organization. You know, we've lost some people to the corporate sector. And that was a big deal for us because I can't compete with those salaries. I'm pretty comfortable with our salary levels across our organization. We worked for a number of years to try to lift up our salaries well above minimum wage, which I think is really, really important. And I consider that a benefit of working at Island Harvest. We too share something that David mentioned, which is the benefit of referring people to the organization. And we think that it's pretty generous what we're offering. You know, I'm not a big fan of remote work because we're doing work where we have to be helping the community. And so in my mind, it's not fair for those who are in the office to then have that benefit to work remote. And so that's a challenge for us because there are a lot of people that want to be remote. And it's offered elsewhere. And so so we have to find new ways to keep people ingrained in our organization and not leave just for something like that. We've had situations where employees left because they thought that making a little bit more was worth the move, and then regretted it. And I think that that's another new challenge that's in front of all of us. The grass always seems greener on the other side until you get there. And the culture is not what you expect it to be. The tasks at work are not what you expect it to be. Many people are working very independently and solo because of the remote options that they chose. And they're not in an atmosphere where there are a lot of people that they could work with and have those relationships. So it's a challenging time. I think we're all learning a lot through this. I kind of want to look at a crystal ball for 5 years ahead to know where we're going, but we're on the path.
Yeah, I think the phrase is the grass isn't always greener, the brown spots are just in different places. So, anyway, let's stay along the track of staffing here. I mean, obviously, one of the key components of some of the things you talked about reorganization, growth, interns, remote hybrid environments, all of those things have a common need, leadership. You know, and we're seeing a kind of a change in how leadership works within organizations. What do you see as the most important leadership roles, and what are you guys doing in order to kind of bridge some of that leadership shortfall that might exist within your organization? Let's start, Bobby, with you.
Yeah, flexibility. Being a new leader, especially in an art-centered space, right? Even as an artist, I'm a lawyer first. I'm a program developer first, so I'm very stringent about the way that I've gone about leading teams and working with teams and having a sense of urgency and having these expectations. And so now there's a higher sense of emotional intelligence that I've had to leverage in the space to make sure that we're connecting to maintain retention as well, but also thinking about investment and capacity building. So to tie into my point in number 2 about multi-purposing, that also requires more training, right? So by investing more into my staff, that's building some trust and them understanding my role as a leader, being more transparent, right? Working with the board is also very different for me, having that volunteer block. So having to understand about being transparent, better communication, and bite size, right? Knowing that in some spaces, especially those of which I came from, which I developed my leadership module, it was a lot of autonomy in my work, right? I didn't have to be micromanaged. I didn't have to really set a schedule out. People said, go forth. And I was like, you got it. Here, I'm understanding that there's varying needs, right? Some people need micromanagement and some don't. So having to create those different blocks for people to grow, it's something that I've had to pull into it, right? And then listening, doing a lot of listening. Because while you have some team members, especially on a small team like ours, it's hard to create little pockets of clicks, right? Because you're a part of so many different clicks. So creating space for people to share, right? Uninhibited, it's something that I've had to incorporate as well. And I think that will eventually over time help with retention and strengthening my leadership in this team as we pivot to grow.
Yeah, I think you said it. I mean, giving people an opportunity to kind of flex their wings a little bit, I think is kind of helpful. Randy, do you want to add anything?
Yeah, you know, look, I grew up in the business world and the nonprofit world with the concept of need to know basis. You know, in the older days, management didn't share everything with everybody within the organization. And that was the style for a very, very long time. I think from a leadership perspective, it's been a path for me in my development because I have to develop and grow in order for my staff to grow as well. My thinking has to change and align with today's thinking in order for the organization to grow. And so, you know, that was something that we recognized a number of years ago and really started to look at how can we engage our staff in some of the decision making, and what are the methods that we are putting into place to give them that opportunity. And it's hard because I have some senior staff that that believe in or think that they believe in it, but in practice, they still struggle with that. We have consultants that we brought in, leadership development consultants. I've done it a couple of times. I think it's really, really effective because it also allows a separation between our senior staff and me and our other staff so that they have somebody to go to discuss some of the challenges that they feel they have within the organization. And then the consultants can work with the team, the senior team, to try to make some of those changes within the organization. So I think our biggest struggle is working with allowing our supervisors and managers to have some decision-making power and ability, and to be part of the discussions for the larger discussions within the organization as well.
Great. Lisa, David, either of you want to add anything?
I would very much second what both Bobby and Randy have said. I was in my youth growing up, I was very familiar with the authoritarian leadership model. This is what I say, this is what you do. And I've learned that that style isn't necessarily conducive to the kind of organization and company that we need to be. So I'm finding myself doing, as Bobby said, a lot more listening and figuring out I am not a good micromanager. I don't enjoy it. I don't want to have to do it. And there are people who need that from me. So learning to do that on my side, as a leader, I'm much more, here's your job, get it done, here's the deadline. That's not as effective as my brain would have allowed it to be. So I've obviously pivoted and have worked towards listening and learning from each of my staff, not what they say, but what they don't say, because that's often so much more poignant. What they tell me, okay, fine, no problem. What they're not telling me is, oh, here's the whole backstory of why I need this. And what I really need is that support instead. So by listening, it's almost like an executive director, human resources position merged. And that's kind of what needs to be in order to maintain a staff that you have to motivate their dedication and their passion and their love and give them as many opportunities as possible to be their best selves. So within the organization, what can we do to support them?
I was going to say, I think we're seeing a lot more staff are looking for more feedback, more empathy, more education. They're looking for an understanding of upward growth and potential and all those things. And there needs to be a lot more communication than ever before.
You stole my thing, Ken. I was going to tell you, like, we over communicated during this pandemic, and now, like, we've had town halls all the time. We continuously, you can't over communicate enough to your employees and have those as dialogue. We do staff surveys to hear what people are thinking anonymously, but work on the things that they say and give it back to them, support them. And a lot of, I think everybody said training. So if we can, we bring in consultants, as Randy has said, but the more you can listen to what they're saying, we're all in the people business, right? It's not just that we take care of people, but the people we manage, we have to take care of. So as leaders, we have to adjust to that. And I found that A, I've got to give my employees the tools to succeed. And B, I've got to make sure we're constantly in communication of where we're working on, what are their challenges, how do we help address them so we can move forward. But you hit it nail on the head. You can't over communicate enough in our roles. Give and take has to happen all the time in various formats.
So let's switch gears a little bit. I mean, obviously the last couple of years have been tough from an economic perspective. And there's been some economic turmoil that have impacted operations, have impacted fundraising results. What have you guys experienced, and what are you doing to combat that? So David, why don't we start with you?
Thanks, Ken. So yeah, the economic forecast has changed dramatically. So we got a lot of money from the American Rescue Plan that has ended. New York State, I think I saw you earlier today, has this budget for Medicaid was going to increase 7% or something that is. But we're an outpatient provider that takes a lot of Medicaid. That didn't apply to us. So we had to kind of shift. We've been working on it for years to how to access funds differently in this economic environment. So we have involved ourselves in what we call, for our organization, value-based payment. In the medical world, basically, we want to take care of people. And the better we take care of them, the more we save an insurance company, then we get a piece of that. So we've been able to grow our value-based payment where we are saving and sharing in some of those savings. Fundraising, we hadn't done it before. So we've started fundraising, mostly because my board is very different than others. So my board members, by federal statute, 51% must be patients who use the health centers. My board members don't have high incomes. A majority of my patient board members are on social services, are on Medicaid, or lowly employed, so they don't have donor capacity. But we've started small things. We have partnerships that have evolved too. We got a grant and we were taking care of new moms, and we reached out to some of our partners, and Northwell wound up giving us a whole bunch of cribs and things for these new moms, which was great. And so we're trying to make different partnerships and different connections in this new world, because we found that through partnership and through collaboration, we've been able to kind of not only survive, but thrive. And it looks like when you're mutually beneficial, that it becomes win-wins. You know, we're applying for grants with others, with large systems, with small systems. We're doing work with Randy, we're doing work with others, because it takes a village to do what we do. And so unfortunately, we had to pivot away from some of the, I wouldn't say easier money, because it was not easy during the pandemic, but it was federal dollars that were large and was helpful to keep us afloat. And now we just have to be much more creative and to figure out how do we still follow our mission, but on another path. And I think that collaboration has been huge for us, and is actually it's paying dividends.
Yeah, I think that's important. We're actually seeing more and more community-based funding taking place. So yeah, that's kind of in line with that. Bobby?
Yeah, absolutely. Like Randy had said, diversifying for sure. We definitely need to diversify our revenue streams. Especially for us, we receive a high percentage of our city contracts, contribute to our revenue. Then, trickle down to individual donors, founders, foundations, and so forth. And recently, we've lost a significant amount of funding at the city level that will have a long-lasting impact, right? But as we are going to be able to navigate out of that turmoil, we're also, again, being reminded this is why we need to diversify, right? Why we need to think about expansiveness in our programming, expansiveness in our mission. What does it mean? Like, how can we be more creative about the work that we're doing that reaches other audiences, right? Thinking about, and then also partnerships, right? We are not working in silos. So being able to understand those who are doing similar work and connecting with them and creating multi ways of doing impacting this work a little more deeper. And also, I think one of the largest issues that we're facing, and we spoke about again, is controlling your narrative when going out for funding. Us being such a niche in the art space, really being able to create, this is the impact of our work outside of the criminal justice system and their rubric of effectiveness. This is the impact of the work from the art to the young person, and being able to translate that a lot better, I think is positioning us for better, deeper funding conversations as well.
Awesome. Randy, Lisa, either of you want to join in the discussion?
I would actually second what both have said. We have found, being a young organization, we weren't eligible for a lot of the funding that came in through the pandemic, because we only started in the pandemic. So we've gone on a not-for-profit business model, and we are a performing arts company and an education-based company. So earned revenues for our services has really helped us to sustain our base of operations. So that aspect of it, we had virtual shows, different products, ticket sales, whatever. So we were able to have some base level of earned income, as well as our not-for-profit income and our donations. Our board is very similar to yours, David, in that our give or get is time or energy, or both. So our board members are actually functioning as our executive team right now, and they're fabulous. So it's very much a hands-on organization at this point in our growth. So that's been a big part of it. And it's one of the places where it's like got big red letters on it. This is your next avenue of growth. This is where we need to focus and put some energy into figuring out pathways and partnerships. A lot is with partnerships. We love working with people. And as you said, right, a rising tide lifts all ships, right? We love collaborations.
And again, I think you're seeing more and more of that happening, and I think it's necessary within the nonprofit sector. Let's switch gears again a little bit. I mean, I think we're seeing that there's been somewhat of an aging in the nonprofit leadership. We're seeing a lot of movement where succession planning is becoming a very, very significant issue in the nonprofit sector at kind of all levels of the C-suite as well as the board. And when you kind of think about all of that. So in terms of that, what steps are your organizations taking in order to prepare for change and being, ready and prepping for that? Randy, let's start with you.
I think one important thing to remember is that if we're talking about the CEO role, the ultimate decision on that position, if the CEO leaves, is the board. And so succession planning is important, but it doesn't always guarantee who the successor would be. It just sort of establishes a process. So for our organization, we established something a number of years ago for the CEO for my position, but we're actually also using this method for our senior team when senior leadership steps away as well. And so when the person chooses to leave or take an extensive amount of time off, in our case for the CEO, I have a senior leadership team of 6 people that head up 6 different divisions. And so they would be meeting on a daily basis and making all decisions as a team together. And the chief human resource officer would be reporting on a weekly basis to our board chair and our personnel chair. And that's the beginning of our succession, so that it gives the board a chance to make some decisions about how they would want to move forward. We're in the process of using that format for a senior staff person that's here. And she has a supervisor team that are running all of her programs. And so as she's stepping away, we're using that leadership team to meet together daily to strengthen their work together and make sure that they're crossing every T and dotting every I, and then reporting up twice a week to me and to the head of our HR department as we make decisions about how to fill that role.
David, you want to jump in?
Sure. Yeah, a couple of different things came on. One, I'm on a board that had a CEO pass away. And so that was really shocking. It's the person was sick for a little bit. So there is a succession plan, a board plan for that organization. Should that happen, what to do next, how the board will intervene, the amount of time. And so there's a good succession plan written for the board and for the senior staff, so people know what to do. Similar to Randy, a senior person would take over in that instance temporarily and report to the board, which is great. What we do for our organization, our board, is because we have these patient board members, it feels like we're always doing succession planning, because our board members, this is sometimes their first interaction with a board. And so we have to educate them constantly. We actually, through our national association, had a 10-week course on educating the board members how to be a board member. And that then brought in some people to self-select out, some people to stay on, the responsibilities. So it's evolving for our patient board members as an ongoing process and part of our strategic plan. So that's an ongoing process. And I think organizationally, we've got to do a little bit better job for me personally. But I like to be around, but God forbid something happens. We have shared that other boards plan, because you never know what could happen. None of us are going to be here forever. And so we have to make sure that our job is to make sure our organizations are sustainable. And so even though sometimes we don't want to talk about it, people don't want to talk about death and dying, and we don't want to talk about succession planning at our level, but you need to do that. So our jobs as leaders is to make sure that our organizations can survive without us, and to put systems in place with our boards to make sure that no organization is one person dependent.
Yeah, I think some of the larger organizations have a little advantage over the smaller organizations because they get the layer of leadership, which kind of helps to ensure that somebody can step in if something like that happens. It's a much tougher challenge for a smaller organization that doesn't have that leadership, and it kind of creates maybe a little bit of a void there. Lisa, Bobby, either of you want to jump in and kind of touch on this in terms of succession?
Yeah, I agree. That's me. We're a small organization. It's just me for right now as far as the leadership. So it is difficulty. And I'm the first ED after the founder, right? So when I think of succession, it's leadership, but David hit right on the head, the sustainability, right? Like that needs to be reached first before you think of the succession and leadership who's coming into place. Is your organization sustainable? Right. So right now I'm at phase 0, right? Like creating a sustainable organization. So then a succession conversation is relevant, right? It makes sense to have because, you know, without it, that's kind of what I've been juggling with, preparing for me to come in. It wasn't a plan in place. So to not scare the board off, first is documenting, making sure we have processes in place, archiving, there's receipts of the work we're doing, right? That has to be organized first, and then moving on to that sustainability. We're into that.
Yeah, I think one of the challenges there when you kind of talk about it, you know, we've seen organizations where they didn't have that sustainability and didn't have the leadership in place actually either fold or get acquired. So, which is part of the succession plan too. Lisa, anything you want to add?
We're at a very similar place from Bobby. It's primarily a founder-led organization at this point, and we are working towards a sustainable model that can have a succession. That's the dream. Right now, it's still a dream.
So Bobby, you brought up sustainability, and you brought up, you know, the need for organizations to continue to kind of think through who they are as an organization and continue to move forward. What do you see as some of the challenges from 2023, maybe rolling into 2024? And, you know, what are you doing as an organization to kind of deal with those challenges in order to come out of it stronger, better, more relevant?
I guess with any sickness or disease is acknowledging it first, acknowledging that it exists, right? That's the first step, is having the full transparent conversation with the board from the top down, right? Like, this is the issue at hand. We did not do this. This was not in place, right? And just having to take those L's on it, and then talk about solutions and put that in place. But also have to prioritize, because we don't have money falling off of trees. So creating a more scalable benchmarks, like over the next 3 or 5 years, what do we need to accomplish in all these varying ways that we're not there yet, right? So thinking about that more strategically. Again, I think some of the nonprofits, especially the small ones, is something I'm pushing with my team. Flush it out. I know they hate that, but I say it all the time. Plan. If you don't plan, then you plan to fail, right? We know that, oh my gosh. So we're constantly saying that here, plan everything you can, document it, big yourself up, right? Let people create your own story. That's what I said before, like, it's super huge for us that we control our narrative, and we let people know who we are, right? No one introduces us, right? We make it very clear, this is who we are, this is what we do, and we norm our language around that. So it's a lot of internal insight building, all of that, everything I addressed.
And if I could just add something, and build on what my colleagues are saying, as far as transparency and communication. A colleague of mine approached me because they were going through a transition with their CEO, and nobody in the organization knew what was going on, none of the staff. The board had a plan, the board was doing all sorts of things to work on the succession, but they left that one piece out, and that was the one important piece, because they were not communicating enough with staff. They thought they were, and that was a really big mistake for them, because they started to lose a lot of key staff that were just too afraid to stay on because they were just unsure of what was going on.
Yeah, good point. Very good point. So kind of getting back, what do you see some of the challenges going forward? Randy, you came off mute first.
Yeah, you go, Randy.
Okay. Look, I think we have a changing workforce that's emerging, and we need to learn about what this changing workforce is and who they are, and how we could support them. And as leadership changes, the emerging staff coming in are starting to change the culture of organizations. And it's just really, it's scary for those of us that have been around for a long time. You know, it's difficult for us to manage some of that kind of change, what people want to wear, where they want to work, what kind of equipment and technology they're interested in, how frequently they want to meet or not meet, what the work setting, what they'd be comfortable with. And in some sectors, it's what are they doing for the social good of the community? How are they involved in social good? And so that's where there is so much change going on. And when we're looking at succession and change from a leadership perspective, some of those things need to be included.
David?
So on a macro level, economic level, I think it's going to be a little bit harder at the end of this year and next year. I just think they'll New York State is projecting, I think, losses, and we get a lot of our funding from the state and federal government. So that'll just be hard for us. It'll require organizations like ours and probably some of the people on here to think a little differently, to pivot, not totally change, of how we accomplish our mission. I think it'll be a little bit more, we'll have to look at things differently in terms of those, what are those collaborations? How can we use different partners to succeed? Where there's opportunity, I still think there'll still be federal grants and state grants and local community funding, but it'll be a little bit harder for us. So I think leadership teams are going to have to be more flexible. As Randy had stated, we're going to have to definitely hear from the people who work for us and support them differently. Knowing what we do. I think it's also acknowledging for us, acknowledging years of health inequity. And so we have to acknowledge our communities differently. And I think for us, one of our plans is to really do a better job engaging our community, because we know that if we're doing this together, we'll definitely provide a better service, and it won't be top down, it'll be community based. And so I think how we interact with our community and our stakeholders is going to be different at the end of this year than maybe it was in the last couple of years, where we're just waiting for people to come and vaccinate or masks and doing a lot of things Zoom, where now we'll be much more engaged with our community. And I think those things will help all of our organizations to carry out our mission and improve some of the outcomes that we want to achieve in a much more challenging financial market coming next year or so.
I just want to kind of just ask a follow-up question, David. So you're talking about, and I think part of the way you're structured kind of helps with this, but you talk about how do you better interact and interface with your community, and part of it is you have community members on your board and stuff, so you're actually getting a good perspective in terms of what some of your needs of the community are from the people who are in the governance positions. There's a lot of organizations that aren't set up that way. Talk maybe 5 seconds about why that you set yourself up that way, what's the importance of it, obviously, and go
right. So we're a federally qualified health center, and so that's a national designation, and we're required to have 51% of our board be people who use our services. Our board members are actively involved in their community. One's a library board member, so we're having conversations there. One works with a local school district, so we're having conversations there. So they're very connected, and they're our eyes and ears. Organizations like ours have to do a needs assessment, and so they kind of say, hey, this is what I'm seeing as a need. 3 of our school-based health centers, they came from board member interaction, saying, hey, there's a need in this community to provide primary care and behavioral health in the high schools. And that's how we got there. So I think we've kind of been isolated the last couple of years, just kind of survival mode because of the pandemic. And now we have to kind of go outside the 4 walls of our organization and much more engage this new mental health challenges that are happening and things. And our board members are really, really good at telling us what's going on and making those connections, at least for our organization. And then my job as a leader is to engage the other community stakeholders so that we are pivoting to the needs of our community and doing things financially sustainable as well.
Yeah, thanks. I just want to make sure that message was heard by everybody, because I think too often people are focused on board members that have the ability to provide funding, where it's equally important to have board members who can provide insight.
Oh, 100%.
So thanks. Bobby, Lisa, where do you see things going? Anybody want to provide any additional insight, or did we cover it? Okay.
I would add only just to note, to reinforce what has already been said, that I see us going really more even stronger into collaborations, into supporting each other as not-for-profits, and to finding ways that, oh, well, here's one corner of your nonprofit that in which we intersect, having a large Venn diagram essentially, and figuring out how in different ways we can support each other, because I feel like that's really going to be the strength and the foundation for a successful industry, because we are an industry. We're an industry with a social message and with a social reason, but we are an industry, and what we do is very important. And I feel like the more we work together, the stronger that we will all be. I want to add one quick quote, which is from one of my performers. When everyone is afforded access and inclusion, our collective contributions make the world a better place for everyone. So together, that's by Rick Daniels, who's one of our performers.
Let's, if we can do just like one parting gift for the audience. If everybody really quick, one thing you want to leave the audience with in terms of what they can do to run a better organization moving forward. So Randy, let's start with you.
Oh, you had to start with me. That's not fair. Look, I could just build off of what everybody's been saying. I think there's been some great nuggets that everybody shared. And I think listening, if I'm going to use one word, it would be listen more and try to engage in talking less, so that we could absorb what people really need.
Lisa, you're up.
I jumped ahead. I gave you my nugget.
All right, Bobby.
Yeah, in addition to what everyone else said, I would say study the industry and control your narrative. Very much so, as much as importantly as we go into these budget cuts, what's happening. So yeah.
And then finally, David.
I would say servant leadership and shared governance. You want to make sure you're giving people the support they need. It's going to be some rough economic times, and where possible, help them to help you succeed as an organization.
Awesome. So thank you, everyone. We went a couple minutes over, but really appreciate it. Just some closing things from my perspective. So we do have some additional virtual networking. If anybody wants to be part of it, they can go back up into the lobby after this is over, jump into the virtual networking. We are going to be sending around a copy of this recording. Once it's all done, it'll probably go out. Today's Wednesday, so probably either Friday or Monday. We'll get this out to everybody. As part of that, the evaluation forms will be going out. If people can please take the time to fill out the evaluation forms. We like to hear your feedback. We'd like to know how things are going, what you're interested in, what you want more of, what you want less of, so that we can continue to make these annual conferences and even the other things we do over the course of the year pertinent to you and targeted to what your needs are going to be. We're always looking for feedback, always looking for ways that we can do things better. We're always looking for new topics and new things that you guys are interested in. And again, anybody who needs CPE, we are offering 4 hours of accounting CPE for this. Anybody who does need that CPE, they do have to fill out the evaluation form. And as I said, that will be sent out to you. You don't have to go looking for it. It'll come to you along with the recording. So thank you, everybody. Thank you for being part of today. Hope to see some of you at the virtual networking. And thanks a lot for this panel. You guys were incredible. So thanks again.